All right, we're on. We've crossed over to the other side. Healthcare. Hello, healthcare. Hello, LinkedIn. Hello, YouTube. However you are viewing us, here to let you know that we're live. And the subject matter, always excited about the topics, but we've been on a consumerism kick lately. And that's started out with what's the overall landscape of disruptors entering the field, and what are some of the characteristics that they're using to define the new consumer experience that patients have. We're going in the direction that we're going on this conversation is around the technologies from the marketing technology stack, and the potentially the relationship of that AI plays as well in defining these consumer experiences, creating these new ways, these new modalities by which people are going to be accessing care, and creating kind of that relationship and know me experience. To help us with that, Anne is our VP of Sales here at SymphonyRM. So big hello from you, Anne.
Hello, thank you for joining today.
And our guest of the moment, we brought in Tom Hileman, who runs the Hileman Group and has major experience with marketing technology stacks at all kinds of organizations. So he's worked heavily with Baylor, Scott & White, Cleveland Clinic, and what we thought would be exciting for the audience, especially with all the people in here who have been trying for years or focused for years on being able to put the consumer experience front and center. Tom has done this and led this at a number of organizations. He's got a great background in data-driven and statistic-driven marketing, and he's here to answer questions and talk with you directly. So hello, everybody in the audience. We just want to let you know that this is an open conversation. As Tom says things that you're curious about, or you have stories that you can relate, that you just want to share, let's hear them. Put them out in the chat, and we'd love the back and forth. But Tom, just to kick it off, could you tell us a little bit about your background, what the Hileman Group is, and what you're focused on?
Thanks, Chris. Thanks, Ann. And thanks for having me. And I appreciate everybody online and the various channels making some time in the day. So as you can probably tell, I'm pretty passionate about marketing technology and data. We'll get into that here in a bit. But Hileman Group, we focus on helping healthcare organizations connect with their patients and their physicians, essentially, and patient consumer side, driving patient communications, acquisition, retention, and whatnot. And then on the provider side, more broadly, physicians or clinicians in general, connecting with them as well in that part of the value chain.
Excellent. And out of curiosity, when you started the firm, what were kind of the tenets, or what was the impetus behind this focus that you're bringing to healthcare?
So interesting. So I've been involved. I'm a recovering physicist. So my training is in physics and mathematics. So I view the world through the lens of science and data and analytics. So I guess if you had a physicist design a marketing agency, Hileman Group's what you get. So what kind of the tenets are was really understanding and looking at marketing kind of from a more scientific perspective, right? And back 20 years ago, that wasn't really a thing. Marketing was much more brand oriented, research in that space. But as the technologies have evolved and the data has proliferated, we are now able to track essentially almost all activities in the digital space, right? And the attribution and the tools that we have today are just so far beyond what they were before. So marketing is truly measurable. You can be truly impactful. You can personalize. You can test at scale. So my opinion, the next 5-10 years of marketing is the most exciting time we've ever been alive in terms of all the tools that we'll be able to do, but also as a marketer, our ability to fundamentally help people, right? Our ability to communicate with them. And healthcare is I'm particularly passionate about, because we can do good and do well here together, right? Help patients get to the right care. Some things that in artificial intelligence, I'm sure we'll talk about, the ability to find patients who may need particular help with certain services, whether it be kidney cancer or diabetes, and some of the things we can do with data science to really help and communicate with folks to help them get the best quality of life they can. So fundamental tenets have always been kind of data, the underlying kind of process orientation around marketing, the marketing technology, and then of course the core piece of all this is the messaging. That's what, we talk a lot of data and science. At the bottom of the line, we have to have a brand and we have to have a great message for people, and putting that all together is kind of what Hileman Group's all about.
Well, of all the places that you could have focused on, all the industries you could have focused on, we're really happy that you're bringing that focus into healthcare and focusing on not just like it could have been a situation where it's about optimizing clicks to watch movies and things like that. But this is a real impact that it sounds like you're very focused on. To get things started, we always have a diverse audience. There are people in marketing who might be familiar with marketing technology, but on the other side, there's other people that I believe that marketing technology, because there's so much data being collected on how people interact with various materials, of various subjects and things like that, I think it's something that should be made more aware of across the organization. So could you help us and give us your definition, your thoughts on what marketing technology is and how it relates to the consumer experience?
Sure. I mean, that's a pretty broad statement. So marketing technology, or all you probably hear me make into it to a single word, Martech. I view that as essentially anything that you use. Mostly we're going to talk about technology, software, or online systems and technology data to essentially organize and execute your marketing, right? So Martech is really the underpinning of how you get your message out. I mean, the core fundamentals of marketing are audience, message, call to action, right? So Martech is the basic underpinning of executing on that in the digital realm. So what does that mean? It could be things like your content management system, if you're publishing in a web-based world, or headless content, if you're thinking about mobile apps and different deployments, different devices. It could be a marketing automation platform, kind of orchestrates that. It could be a simple email marketing system, or it could be a CRM where you're collecting the data, or about 50 other things. Chief Martech, I think, had 8,000 Martech ad tech systems that was being tracked in 2020. So in 21, I'm sure it's probably 9,000 or more. Lots of pieces that make up the Martech. In terms of the consumer experience, the way I typically look at Martech is it needs to support what the patient in healthcare, what that patient journey we want the patient to take is. So the Martech should be the underlying support for either delivering those messages, information in a timely manner, right message, right person, right time, right? That it should be orchestrating that. We're tracking the pieces of it so you get the data to be able to understand that patient and personalize the message at scale.
Excellent perspective. And Anne, I was wondering about your thoughts.
I think the Martech stack has always been incredibly difficult from the standpoint of the acronyms and the question of what a CRM actually is, and having a lot of different, just definitions in the marketplace. I think we're getting a little bit closer to what that Martech stack should certainly look like, and the components that are needed. There is no doubt that there is more and more out there from the standpoint of the startups and standpoint of the organizations that are able to provide a lot of different solutions to the, healthcare marketers. But I think what's really important is having a very good strategy on exactly what, is needing to be accomplished and how you're going to lay all of that out going forward, and what works together. I think it's incredibly important too for the vendors that are in that Martech ecosystem to have good collaboration as we get into interoperability and the things that are occurring there. It's really important that we can all kind of hold hands and help our partners out and help our clients out too, in seeing the most of their spend, and also understanding the journey of the patient and keeping that as seamless as possible without too many challenges in the data and the way a lot of this is flowing with all of these multiple systems now working together. Getting it into, as we call ourselves Symphony here, getting it into a nice orchestration takes a lot of work and a lot of collaboration. So I think, Tom, one of my questions too would be, here we are, we've had a couple of decades of really kind of a marketing focus historically on fee-for-service and the service line marketing reality. And I think we've been living with, our feet in two different boats of fee-for-service versus value-based care. And now as we move into that value-based care environment more and more, what happens in marketing And, what are some of the technologies that you're seeing or some of the strategies that you're seeing that are now beginning to influence the marketing departments with value-based care?
Yeah, no, it's a great question. And I think we're still not terribly far along the value-based care curve, I would argue, just given how the current market trends are. No, it's a very different model, right? Fee for service is volume, and specific volumes in specific areas. And there's nothing wrong with that volume from the perspective of those patients need to be served, right? But from a marketer's perspective, it makes you kind of myopically focused on a part of a patient's journey, right? And fitting people into hundreds of different small buckets of where they fit, geography, condition, and procedure, and driving towards that, right? When you think about value-based care, you think about the whole person, and you think about what that continuum of care through the life of that patient is. So I think we need both. I don't think we'll ever actually go to a whole value-based care or go back to a whole fee-for-service model, because I think there's points to both of those pieces. As a marketer, I think value-based care makes us look more holistically at a patient. Population health becomes incredibly important, right? As healthcare organizations have to determine how they best care for populations and how you keep them healthy, as opposed to get fix them when they're sick, right? So that's the mentality of from a marketer, that we have to think about more of the whole person and what's that continuum of care look like, and focus less on sick care and more on health care. Dr. Cosgrove, from the former CEO of this Cleveland Clinic, used to always argue that we need to be a healthcare organization means well care, not sick care. And of course, some people are going to have acute conditions that are going to be sick care, because you break your arm, that's not necessarily a wellness activity, right? Or some of those kinds of things. But from a marketer perspective, I think it makes us look at the whole patient journey. It makes us think holistically about that. Lifetime value becomes very important as a concept. Some other industries have done that much more successfully than the healthcare has. And I think if we think about the continuity of that, that's an aspect that we need to promote. Secondarily, no other industry has caregivers. So that layer is something that's much different in healthcare. So value-based care also has to encapsulate the caregivers, both the healthcare workers, but also the caregivers of the friends, family who are supporting folks through that journey, right? So I think as marketers, we have to think about the whole person, and even beyond the person, their whole sphere of people who help support them as well, and help them through that life cycle of care and keeping people healthy, as opposed to fixing folks who are sick, which is still important, of course, because people are going to get sick no matter what. But it changes the mix of some of the messaging and how we think about how we reach patients.
So Tom, you mentioned a whole host of different marketing related technologies, and we're also talking about this whole and complete perspective of the patient. I'm curious, if we were to look at commonly used technologies or even data sources that marketing uses for its purposes, but is kind of underutilized when we look at the population health perspective. Are there any technologies that in the marketing technology stack that it seems like should be more widely adopted across the organization, and the data that comes from it more viewed across the organization? I'm curious about where marketing can fit into this picture, and where some components are undervalued by leaders.
No, it's a great question. It's a hard one to answer, but I'll give it my attempt here. I mean, I think one of the things that I see really is, I know people talk about AI all the time. We talk about it a lot, but we're not really using it all that much, or not even near to what its potential is from that perspective. So I think in healthcare, we've got piles of data, and it's almost like we have rooms that we just scoop data into. If you think about all the interactions that we have with either our digital, there's digital engagement analytics from web, mobile, social, all those advertising, all those pieces. Or you think about the personal encounters that we have, the EMR systems, claims data, all this stuff. So we have more than enough data, right? In healthcare, we don't really even need more data. I would argue what we need is information, right? So, and I think the difference between the two is that information tells us something useful about the data, right? And so I think AI is actually vastly underutilized in healthcare today. We're seeing very simplistic applications of it, and I don't mean in a pejorative way. So like Google, they have their optimizing AI in terms of bid costs and whatnot. And that's a fine use, but that's not nearly enough. We have data that we can help patients to understand who they are, where they are, what they even may have from a disease condition, likelihood, instance of care, getting in for annual wellness. We have all this data that we could be using. So data to me is vastly underused. I also think marketing automation systems are vastly underused. People think of them as kind of batch and blast email. Well, marketing automation does way more than that, orchestrating the patient's journey through the healthcare system with the right information at the right time. They're woefully underused, even when you're putting in a larger enterprise tool. I think there's a couple areas. I actually think text messaging is massively underused, specifically to reach populations that may not have smartphones, which are typically underserved areas of our patient demographics, right? So almost everyone has text messaging and has access to those things. So I think there's some pretty fundamental things. The good news is, though, is we have tons of tools, right? And I think we have, it's kind of, my comment is like off the old quote, water everywhere, but not a drop to drink, right? We got data and tools everywhere, right? But how do we as marketers really effectively use those and also avoid shiny object syndrome of looking at whatever the kind of coolest, latest craze is? So I think those are the three that I think to me that are pretty much underused today.
Tom, I think about it, and obviously you're a strategist, no doubt, and you work with some of the largest and best healthcare systems in the country. And, when you look at the strategy component about, just where to start in getting clarity with some of this and having a good path for, getting the technology and everything integrated and reaching the patients appropriately. What do you recommend for some of the leaders, on this call and at organizations in terms of a good starting point in building some of this out?
Well, that's a great question. So strategy, I think sometimes we throw tools at things, right? It's almost like hatchets, throwing them against the wall. And we sometimes mistake tools for strategy, right? Or we mistake, we're going to adopt some new system and that's going to solve the issue. When the reality is not really going to solve the issue, right? So tools are great and we need them, but what we need to think about is almost all, in my opinion, of the world of organizations, for-profit, nonprofit, comes down to kind of three things: mission, vision, values, right? What are we here to do, right? Who are we here to serve? And what do we believe in? And healthcare is the most fundamental of that. If you look at the tenants in healthcare, education of patients is critical, right? We need you. One of my friends who's a doctor always tells me that every patient should follow the creed of they need to be an active participant in their own rescue, right? So if there's someone sick, then we need the patient to be involved, both from an education understanding, but also involvement in diet, exercise, nutrition, taking medications, all those things, right? So I think strategy starts with who do we serve, how do we serve them best, and then we layer what our goals are, whether that's to grow the organization size or the reach of the people that we serve, and how do we serve them in an excellent way. And I think that when you start with strategy, you need to start with the fundamentals of what are we here to do today, right? And when I use that very broadly, like what's the organization here to do? Who are we here to serve, and how are we here to do that? And then the marketing, where we live, marketing comes about how do we deliver that message? How do we reach the people that we want to reach? How do we delight those folks and serve them in the best possible way? And I think the strategy should always be about how do we do those things and how do we do them in the best way? And then the tools and the tech and the data, that all follows that, right? Strategy should always lead. Strategy and culture, to me, should always lead in the organizations. And the tools and technology support that. Now, the tools are really important because if you're trying to chop down a tree and you're trying to do it with a pocket knife, it might take a little while, right? So it's important to get the right tool for the right job, but the tool shouldn't set what the job is. If we're going to chop a tree, we should decide that that's the mission, the objective, right? And then we go find the right tool for that. And I think a lot of times in organizations, we get it backwards. We think about a shiny object, a shiny tool, a CRM system, or what it might be, and then we think that'll solve the problem. But at the end of the day, strategy has to be about the people, the process, and the technology to deliver what the value is for that organization.
So I'm 100% hearing what we're saying about technology not leading the like if technology is leading the ship, then it becomes shiny object syndrome. There's so much technology coming out on a monthly basis that if just having the best technology is a priority and it's not related to strategy, then we're just going to be all over the place. So it makes me curious about like if you take that story, that concept of of focusing on strategy and using tech to support that. Are there any organizations, like, could you point to maybe an organization or a leader who does that particularly well, and kind of what's most important in their stack, and basically how they influence these decisions?
Yeah, I mean, there's a lot of folks doing a lot of great work in healthcare for sure. And I mean, one of the folks I'm privileged to work with is Paul Matson at Cleveland Clinic. He's a very strategic thinker, and worked with him for a long time. And I think one of the important things I learned from him was the importance of keeping your message short when you're guiding and leading people, right? And he often talks about digital, mobile, measurable, right? So everything needs to be digital, everything needs to be measurable, and everything needs to be able to deploy wherever people are. This is the mobile part of that. And I think the ability to kind of take that almost to a mantra of where you're heading, so when people are looking at making decisions, they have a framework for that. So that I think that's leading with strategy from his perspective and working with them. They've done a great job. They have a gigantic content engine that they build and do some great work with just reaching patients and educating, and having content that both reaches different audiences. They reach patients for basic education. They reach clinicians, physicians with that targeted information. And so I think that patient education, I think they've done a great job to building out that content, and then also leveraging some great marketing technology, marketing automation and whatnot to get that message out to the right people at the right time. So I think they've done a great job, Paul. I've been fortunate to present with him at a couple conferences and some of the work that they've done. I think they do a great job with it there. Lots of organizations are doing it in different areas, and I think they're a good example of kind of doing it well in the space that they operate in the academic medical center space.
Anna, I know that you've worked in this space for an extremely long time with marketing technologies and have seen. But just wanted to get your perspective on that question as well. Just different. I mean, I know you put out the initial question on what leaders might be able to do, but I think that you'd probably have some valuable perspective and thoughts on getting started with these data-driven initiatives, and maybe if there are anybody that you could think of as well.
Yeah, in terms of, the goals of the organization and everything like that, and strategy, Tom, I 100% agree that it should start with that, mission, vision, values type of reality. And so many folks, I think, have a very complex message that they're trying to get out to the market based on where they're really at. Are they a value-based care organization? Have they taken on risk? Are they, driving, ultimately, all of them that are driving care for patients and their communities. And that's incredibly important. And, you see organizations like even some of the, Geisingers of the world that are out there, and how they're reaching out and how they're messaging and educating their populations about their health. And it's not necessarily, I think, about utilization of the hospital. It's about things like diet or food as medicine, or, being able to just really be a resource for their communities too, in, treating, whether it's an underserved population, whether it's some of the social determinants of health, but, understanding they're part of the community. And, I've even seen some things like farmers markets in food deserts that have been brought in by the hospitals in their parking lots and things like that in some of the Southern California communities. Doing things that go, I think, a little bit above and beyond your regular traditional service and marketing is a lot of what I find inspiring. And what I like to think about some of the caregivers in the community is my hospital as a caregiver and nurturing and taking care of our population, and having that bond and that relationship, I think, that goes beyond a hospital bed is incredibly important. Because again, nobody likes to be sick. Undoubtedly, marketing and hospitals are trying to advertise for something that nobody wants to use. At the end of the day, it might take some of their pain away and some things like that, but it's an incredibly hard marketing task to encourage people to, ultimately have surgery. So the struggle is real on that front. But what I see is, again, truly inspiring is the people that realize that well-care, that health, the community that they belong to, even participation in the events and things like that for screenings and taking people's blood pressure and getting that underserved population actually in for some care, I think is incredibly important and inspiring.
Yeah, 100% agree with that. Like there are a lot of healthcare organizations are taking kind of non-healthcare roles in their societies, whether you said it's nutrition or whether it's simple education. I was at the Stephanie Tubbs Jones facility in East Cleveland, and they have a commercial kitchen in there, which has a bunch of different ranges and different equipment where they teach folks, young ladies when they're pregnant, on different nutrition for them and how they can make that in their own kitchen, right? And they have a test kitchen essentially there. That wouldn't be considered healthcare in most normal senses of the word, right? But being able to provide the ability to show folks how to do nutritious meals with fruits, vegetables, and actually cooking it there together with clinicians, it's pretty innovative, right? And it's solving some really important issues when it comes to nutrition and health. And it's a non-traditional way to do that.
Definitely non-traditional, I think, is always the trick, and where it can be a little bit more inspiring, and you see these true leaders doing things that are a little bit out of the box and not the typical to help solve, I think, some of healthcare's problems. So, I know that one of the conversations is that we've been discussing AI and AI initiatives in Martech too. I do think sometimes AI can be a little bit of a overused or scary word for people, and what does it really mean? And how do we get leaders to really adopt it and define it and not necessarily be exhausted by it is key. But, Tom, what are some of your thoughts in talking to the leaders out there and how they're using intelligence more and more in their adoption of AI?
Yeah, I think it's a daunting prospect, right? You have people who talk about, are the robots coming for us, right? And what does artificial intelligence really mean? And it's probably widely misunderstood. I think most organizations would be best suited if they picked a fairly narrow area to start and pilot there. So pick something, and because there's a lot of internal concerns in a healthcare organization when you bring up the word AI, right? We have data, and we have a lot of privacy and data around that. And so how do we navigate through that? So there's a legal aspects of that. There's some organizational aspects of data silos and who owns what and what are we doing with what. So I think most folks are best started with a kind of a more narrow focus of where they can prove what AI will bring, right? So let's, whether we're looking at patient reactivation, great place to start, right? Everybody wants to bring patients back who may be missing, who may not be back for the care that they need. It's a great way to start and something that people can understand, and then show what AI brings to the table and how you can sift through all that data and find meaningful information and meaningful action out of it, right? So we have all this data, but we have to take the right action. Now that's a really loaded term, the right action, right? What does that mean? What's the next thing that we're gonna communicate or interact with the patient on? That's probably one of the biggest and hairiest problems that a healthcare system has, because there's so much they could do from their online portals, such as a MyChart in an Epic instance, to outbound texting, communications, to patient wellness, to driving a primary care visit or a preventative screening, mammography or colonoscopy, right? So that to me will be that's the bigger problem. But to get to that, we got to solve some of the more narrow ones and get people to understand what AI brings. And I think that's where, if I were starting off, I would start very narrow, get parties to agree, talk about specific objectives, come out of that, show success, because you will. AI brings a level of scale that we can't do as humans or as individual marketers. And then from there, scale it to the broader context. But I think you really have to crawl, walk, run this one, specific with all the very conservative nature of most healthcare organizations, getting them to understand what AI means and what it isn't.
Very inspired by that piece of advice. Starting narrow, I would say is one of the major components that when we look at like installations or things that have failed, a lot of it has been because there's just been too much trying to be addressed at the onset, rather than looking at an approach, looking at where there's some metrics and there's some instruments that we can use, and we can see how effectively we're able to move that metric. So that advice you just gave really resonates with me.
Great.
We are at the we're at the bottom of the hour, and still some folks on, and I really appreciate that when we have a conversation going. Sometimes it goes a little bit over, but we appreciate everybody who's just come and hung out with us and just showed the interest and enthusiasm around consumer experience, AI, and a lot of things that Tom has been bringing to the table. But we are at our point where it's time to conclude and get some final thoughts. One thing that's always interesting is, like, with every guest that we bring in, Tom, you didn't have to be here. You could have been doing something else. There's a lot of other stuff that you could have been doing, but I always feel like there's a reason that you'd come on here and have a discussion with us, and especially with your ideas on a scientific approach to bettering engagement and bettering care. I'm just curious, your thoughts on anything that you'd like for people to be able to take away from this conversation, kind of the reason that you came in here. What were you looking to leave people with here?
Oh, well, thank you. And thank Chris and Ann for having me. I appreciate it. And hopefully the audience has gotten some value out of it. I mean, one of the reasons that I like to do these kinds of events is just to share some of the, we're in a fortunate spot that we get to work with lots of different health systems and lots of different marketing, technology, and creative aspects. And so I think we have a pretty good wide perspective. And humbly, I've made a lot of mistakes in my career, and hopefully people can learn from things. As you mentioned, we talked about the narrow focus. Every time I've tried to do a boil the ocean program, I've inevitably failed because the ocean's an awful big place. And it takes a lot of energy to get that boiling, right? So I'm hoping to share a little bit of lessons learned so that other folks can hopefully avoid some missteps and maybe move a little quicker on things. But I think I'd leave people with is to really, in the last 12 to 15 months, has been a very frenetic time, right? And there's been a lot of concern about loved ones, ourselves, our society, and the way we operate has changed radically. And now it's starting to kind of come back into what the new normal will be. But I think that one thing that I've learned over the last 15 months is to be very intentional about your planning and what you do. And so I'd say, as marketing leaders who may be watching this, is just be intentional. Think about what your current goals are. Take a step back. So we've all been in the fight against COVID, specifically in healthcare messaging. I'm sure all the healthcare organizations here have been impacted and/or have been trying to communicate to patients, customers, whoever they may be, about coronavirus and vaccines and all those good things, right? So we've been in a firefight for a while, and we'll be for a bit more, right? So it's important, though, to sometimes take a step back and be intentional and broaden our thinking. So I would encourage everyone to kind of look at their goals and use this as a moment to take a step back and think about the people they need to do to reach those goals, the process, the technology that they need to do, and just look at it from a holistic perspective. There's tons of technology, so we have all the tools that we need today. Tools will get better and continue to drive and innovate, as we always do. But at the end of the day, most work gets done because someone put some thought into how it should be organized, was very intentional about the team that they built to execute against that and to do the right thing. So I guess I'd leave people to be intentional and take a step back today on a Friday and think about your goals going forward, whatever they may be. And I think that'll serve people pretty well, the kind of time and place we are today.
Thanks so much for joining us today, Tom. We really appreciate it. And we always love our partners and the opportunity to speak with them about marketing technologies and the digital transformation and everything that's taking place. And I 100% agree with you. We're in a new place starting after the pandemic. A lot has happened in this past year, and we look forward to the acceleration and moving forward.
Excellent. And I also wanted to say thanks, Tom, for joining. And I hope that advice resonates. I hope that maybe anybody watching could carve out maybe 10, 20, 50 minutes to really think back and reflect. We can get really scattered. Like if your mission is written down and your goals are written down, I know that we can get really scattered from that, and being able to focus in and narrow in and like all the tasks and activities, make sure that those are on point. That's always a good way to end the week and reflect. So thanks for bringing that to the table. Wanted to highlight a couple of things that we have coming up. Next week, we will have a webinar with Alan Shoebridge and Dean Browell, who have recently written a book called Don't You Forget About Generation X and Their Impact on Healthcare. So all my Gen Xers out there, my millennials too, my boomers too, my Gen Zers, everybody, come on, join us. We're going to be we'll be talking about Generation X and the impact on healthcare and relating to that audience, but that's going to shine a lens on everybody else too, generationally. So we're really excited to have that one. And then following that, we have a conversation coming with Chris Bevelow, who wrote the book, Joe Public Doesn't Care About Your Hospital. So lots of awesome, exciting things coming up. And thank you for joining us, and look forward to seeing you soon.
Thanks so much.
Thanks. Thank you.